Domestic violence has no face. You don't know what it looks like. Just this past day, we had a murder-suicide. Dr. John Dominique Foureau committed murder-suicide, murdered his son's mother, and then went on to commit suicide and kill himself. So many times people are telling me, and we see a lot of cases like this in hospice or home health, and we're having people go to people's homes and they're always asking, why do you even have a social worker in hospice? It's for things like this. We have to be able to talk to people. But the real crux of this is, what does a domestic violence person look like? Let's go through his resume, right? He is a emergency resident physician, emergency medicine physician, Broward Health in South Florida. National Guard, 38-year-old, 34-year-old. He always talks about the significance of serving locally, giving back to the Haitian and Creole speaking population. Again, we're talking about someone who wants to go out, and for the most part, he can be helping a lot of indigent patients. People that just came over may not even qualify for Medicaid just yet. This person, also a college graduate, obviously, joined a fraternity. This is not what you all think a domestic violence person looks like. They don't have a face. They don't have a face. We have to start taking the stories of women more seriously, particularly when it pertains to domestic violence, domestic assault, and giving them a way to get out. For women, when you're in these situations, continue to talk to your loved ones, talk to your girlfriends, and don't be ashamed of telling the truth about what's happening to you in these situations. For men, and I'm going to say this, he and I are part of the same fraternity. We didn't do a good job of hearing him out. It's that plain and simple. We have to talk to each other. When I go through things, or they go through things, I don't care what your case is. You're not happy with your partner, you're going through a divorce, if you're going through a custody case over your kid, these are things that someone else has gone through those things. Nothing is new under the sun. Do a better job of communicating with one another, and if nothing else, be okay with being vulnerable, being open, having real conversations with people that, if can do nothing else, hold you accountable. Things like this should be avoided. I'm not saying he didn't have stress. I've read this somewhere that maybe he wasn't even working at the time, or something might have happened to him at the hospital. We don't know. But what we do know is this could have been avoided. More than anything, we got a 2-year-old orphan. I lost my parents at 35. I could not have imagined what it would have looked like growing up without my mother and my father at 2 years old. The life of the kid, the trauma for the kid. What does that look like going forward? These are all questions that we have, but most importantly, we don't know what domestic violence looks like. When someone tells you they have a problem, take it seriously. Thanks.